Hi everybody. Welcome to our special series on this World Heart Day from the Preventive Cardiology and Rehabilitation. My name is Khushboo. I am a cardiac rehab specialist. As a cardiac rehab specialist, I see many patients wonder that why at this age, why this at young age we are getting this heart disease. So today we will dive into that what are those risk factors which we can check early with the modern tools and how can we uncover these dangers before the symptoms appear. Joining me today, Dr. Madhusudan, who deals with a lot of young patients and who are suffering from the heart disease. So welcome sir on this series.
Thank you.
So first question out of all sir, that nowadays we are seeing a lot of young patients who are ending up with the heart disease. Before this was like a 50 plus disease, but what has changed that why this is happening in young patients today?
I would like to blame it to the lifestyle factors. There are a lot of lifestyle habits like smoking, drinking, which is very much prevalent in young individuals. Also, the lack of sleep that we see routinely. Then the diet habits that we have recently. A lot of junk food, processed food is being consumed, and also inactivity. There's a lot of physical inactivity what we see in our younger individuals because of convenience probably. All of this on top of the traditional risk factors are leading to lot of heart disease in young individuals.
So I think, sir, like nowadays it has become a trend that people do check their heart rate and BP, and many a times people come with that our BP is absolutely normal. It's 120/80. But when we are putting them in even a minimal light activity like walking or putting them on the cycle or treadmill, their BP response is quite high. Is that 120/80 still normal or it's an outdated practice?
I wouldn't say it is just one BP recording that is very important. Blood pressure is always supposed to be a range. It is supposed to be in a good range. What happens is, as you said, when you put them to stress testing, usually the blood pressure shoots up. That only means that their baseline sympathetic activity is high. That leads to a lot of heart diseases also. So, we not only need to see the blood pressure, but it has to be seen on multiple readings. And what I always also see is we usually a lot of people usually give importance only to the upper value of the blood pressure, that is the systolic blood pressure. We tend to ignore the diastolic blood pressure, that is the lower value. I in my routine practice also I see patients who come with blood pressures of say 120 100 millimeters of mercury, wherein already the diastolic pressure is very high. So these set of individuals need to be identified early and have to be put on treatment so that they don't end up having heart diseases.
So actually, sir, like if today one decide that they want to understand that if they are at the heart risk or if they are hypertensive or at the risk of having hypertensive, so what are the screening tools which we can use to make sure that if we are hypertensive or not?
We have couple of tests here. One which is called as home blood pressure monitoring. Lot of heart failure associations and guidelines are recommending that, where we check blood pressure at a specified time in the morning and evening for at least 2 weeks and take an average blood pressure recording. If it is high, then probably we can label them as hypertensives. Similarly, something called as ambulatory blood pressure monitoring can be done, where a blood pressure measurement tool is strapped to your body and it takes multiple recordings through the day, which tells you your average blood pressure, daytime blood pressure as well as nighttime blood pressure, and it can detect blood pressure way early than you can measure it by yourselves. So probably if you can address that, you can prevent cardiac diseases in them.
Okay. And sir, like when it comes to also nowadays we are doing this blood test and all of it, and generally we get it done the HbA1c, which is a diabetic marker usually used. Nowadays, people, especially in the young generation, who comes to us and tell that my HbA1c is just 5.4 or 5.6, which is considered pre-diabetic, and we'll take care of this later. So, what is your take when it comes to this borderline or pre-diabetic HbA1c? Are they still a red flag when it comes to preventive heart disease?
Definitely. See, I would say over diabetes, that is people whose HbA1c is more than say 6.5 or 7, is just a tip of iceberg. There is a whole mountain of pre-diabetics or high insulin resistance patients who are going undetected. So what happens is, before diabetes becomes apparent, people develop something called as insulin resistance. This insulin resistance is not tested in most of our screening tests. We can test it by doing something called as fasting insulin levels and an HOMA IR, which can be done. Probably by doing that, we can pick these people early with insulin resistance and try to give them non-pharmacological treatment so that they don't develop diabetes, neither do they have inflammation associated with diabetes.
So, like, is that correct, sir? That if, like, for example, in a family, mother and father both have diabetes, do the child have the higher chances of having diabetes, or also higher chances of having an heart disease?
Not always, but diabetes, as you know, is multifactorial in origin. It need not always be hereditary. But we have seen if you have one parent having diabetes, you having the probability of having diabetes may be somewhere around 10 to 20%. Whereas if both of your parents are diabetics, then probably you having the risk of disease, developing diabetes, may be around 30 to 50%. But it is always better if you have your parents to be diabetic to get yourself screened regularly, not only for over diabetes but also for insulin resistance, so that you can get yourself treated early.
And sir, like, for example, nowadays many patients who come with the stenting or bypass, we are seeing their lipid profile was always normal, but still they are ending up with like a bigger blockages. So, is there our lipid profile failing us somewhere?
I would say devil is in details here. Okay, so what happens is I do get a lot of patients who come with just a total cholesterol value, and on the outset it looks like it is normal. But what we fail to understand is what we need is the subtypes of the lipids. That is the HDL cholesterol, the LDL cholesterol, as well as the triglycerides and VLDL cholesterol levels. So usually we can see that some of them, even though the LDL cholesterol is in normal range, they can have high triglyceride levels, low HDL levels, which can predispose them to development of these heart diseases. Or even in cases like familial hypertriglyceridemia, they can only have elevated VLDL cholesterol levels or IDL cholesterol levels, which may not be routinely diagnosed just by a total cholesterol. So probably once you get these things done, you may be in a better place to decide whether you really have very high risk of heart disease or no.
Okay. But like if somebody who has like a good genetic predisposition to have an heart disease, like what are those factors when cholesterol is concerned? What are those things which we can check apart from lipid profile, which can give us maybe a early sign that maybe this person is at high risk of heart disease?
I would suggest one, a detailed lipid profile is what is more important. Apart from that, there are certain markers like lipoprotein A levels and ApoB levels which can be done, which can show a very high genetic risk of developing heart diseases. Probably in patients with these, you can try to take corrective steps early and prevent a heart disease.
Okay. And how much do you think that, inflammation play a role in this? Like many a time we tell our patients that, it's like a slow fire. You should check your CRP levels, homocysteine levels. But they tell that, no, it's not a heart disease marker and it's okay, it's fine, we will not check it today. So what is your take on this?
As you know, heart disease that we are talking about is basically caused by some process called as atherosclerosis. Atherosclerosis is a process of inflammation. So, as you said rightly, inflammation is what sets in the damage process. Okay, so all these risk factors, as we have already discussed, high BP, diabetes, high cholesterol levels, all of them produce pro-inflammatory cytokines, which lead to inflammation and cause this process of atherosclerosis, thereby causing blockages in your vessels supplying your heart, blockages in the vessels supplying your brain. All these things can happen. So definitely, as a screening test, we would always advise getting markers of inflammation done, especially something like high sensitivity CRP levels or something like serum homocysteine levels. Thereby, we can understand the predisposition of an individual to develop heart disease or atherosclerosis.
And like nowadays this has become a trend that we pop up a lot of multivitamins, but when it comes to vitamin D and B12, we use that as a physiotherapist to exercise recovery as well. So what is the vitamin D and B12 role for the prevention of heart disease, or it's just a side note?
No, definitely. Vitamin D and vitamin B12 are important for prevention of heart diseases. In individuals who have been found to have deficiency of these, correction is really required. But what has happened is a lot of people have been using vitamins as just a pop-up pill. I wouldn't recommend that to be done. I would definitely recommend you to visit a physician, get your deficiency levels checked, and only if they are deficient, get it corrected. And it's not just vitamin deficiencies that is important here. There are certain micronutrients that are required for the heart uh, well-being. So what you require is something like selenium, zinc, or even cobalt levels what are required. So probably if you have such deficiencies, those also have to be corrected so that you don't develop cardiac issues.
Yeah, so checking them and maybe going to your cardiologist will be a better idea instead of taking a multivitamin.
Definitely. Rather than taking it blindly and on yourself, because nowadays you can see there's a lot of online marketing of all these multivitamin products as a nutraceutical. But not all nutraceutical may be beneficial. Okay. So what you need is whatever deficiency you have, probably if you can address those deficiencies, that is what is more than important rather than just blindly taking all of this.
And one more thing, sir, that which always causes a debate in the rehab is that our ancestor used to eat rice, sagi, and why are you telling us no? And what has changed now that people should be careful to not eat such plain carbs?
Nothing much, I would say. Only thing is, as you know, probably in our ancestors who used to eat a lot of rice also used to do a lot of physical activity. That has changed now because of convenience, I would say. Now we get everything with a flip of a button. So probably the convenience has flipped the what do you say the balance towards inactivity level. Because of which probably we cannot continue to consume similar level of high carbs what our ancestors were taking. Definitely carbs are okay, but probably you should try to replace them with certain veggies also, and try to make sure that you have a balanced meal rather than just diet rich in carbs.
Yeah, maybe going for the complex carbs will be a better choice than eating your plain rice.
Rightly said. I would suggest people should nowadays. What is happening is lot of people. What we are using is lot of polished rice is being used. Other polished cereals are being used. So instead of it, we should try to consume whole grains, which can give us lot of nutrients also, and give us a better health also.
Okay. So like we see when person is fit, fine, lean also, but they have like a strong genetic history. So do you recommend anything else apart from this blood test which can make sure that they will not end up with the heart disease?
Yeah, I would say nowadays, because of the awareness around the health, a lot of people are trying to get fit, maintaining their weight. All this thing is actually a good behavior change. But what is happening is probably what they do is they just get one baseline ECG and then echo done, which just gives you a baseline evaluation of the heart, which doesn't give you the true picture actually. So, in people who want to indulge into excessive physical activity, I would suggest getting something like a CPET or a TMT done, which will give the exact risk for your heart disease. Probably in this set of patients, we can do something called as calcium sporing if they are slightly middle-aged or elderly, or we can do something called as a CT coronary angiogram, again, which can give us a risk of developing heart disease, so that we can prevent any untoward incident happening when they go for a very high endurance training.
So when somebody doesn't have a symptoms, doing all of these things as a precaution is a right choice to make.
Definitely, because when you even when you don't have symptoms, we do get patients who say, "I am training for an Ironman." So in that case, I would definitely suggest get yourself screened properly, and then go for this high intensity training, because that's what will help you.
So, in a case scenario where patient is or any normal individual who is doing endurance training, we see that when we are adding little bit of resistance training also, that do lot of wonders in terms of gaining the physical strength and also their diabetic control and all of it. So, what is your take on these two training when it comes to preventive cardiology?
Yeah, when it comes to preventive cardiology, I would say both of them are equally important. What is that we look for is a good mixture of endurance as well as strength training. We would initially like to exposure our patients to endurance training, like say walking, jogging, swimming. By doing this, their basic cardiopulmonary activity levels go up, and once that happens and they achieve certain good levels of activity, we would like to expose them to certain resistance training. Because of resistance training, what happens is there will be a muscle buildup, and because of this muscle buildup, what will happen is the metabolism improves, and we have seen there is better insulin sensitivity also in such patients, thereby leading to better outcomes. On this note, I would like to have a question with you, because I do get a lot of patients who come post procedure or post cardiac event saying that, sir, we have been doing endurance training, strength training, in spite of all that, still I am not able to achieve the activity levels which I used to have pre-procedure. Okay, so what would be your thing on this, and what would you do differently here?
Actually, sir, when it comes to cardiac rehabilitation, this misconception is there that it's just about exercise. It's not. Actually, cardiac rehabilitation is the whole picture where everything is been tackled. It is about your nutrition. It's also about your stress management. It's also about like how can you make your habits better. And this entire thing will help you into the prevention and also into after your cardiac event. And when it comes to exercise training per se, I think that it's like a medicine. And so first you give a dose of exercises and then you see a real time change that what is happening into that patient, how the patient BP and heart rate is changing. And according to that, we have to change the prescription. And also like if they have any comorbidities or not, we also change our training according to that. So I think looking the whole picture will be an ideal scenario. So that's how rehabilitation is giving a quicker result in compared to doing random training otherwise.
Yeah, rightly said. As I would say, rather than just taking up this exercise program as do it yourself thing, I would suggest always take a expert help initially to build up your activity levels, get a good endurance levels, then do some resistance training. Once you have taken a expert help and probably gone through everything, you can do it yourself at home also.
Correct, correct, sir. So bottom line is that it's not just about your birthday candles; it's also about your heart candles, right, sir?
Yeah, age is just a number, as somebody has said it. It all depends on how young you feel at heart. So it is always important for you to get yourself assessed to see how young is your heart. Okay, and to do this, you have to get yourself screened regularly, so that you don't miss out on any of these risk factors and prevent ending up with a heart disease.
Thank you so much, sir, for the amazing session and very good insight on this topic. So, as we understood today, screening is the best prevention out of all. So, know your heart age today so tomorrow doesn't come as a shock. Because stronger the screening, longer the living.